Hey everyone, I appreciate all the support that you guys are giving me on the last couple of videos, dropping comments, asking questions. It's all great, I really appreciate it. I'm making another video for you guys today. So the last couple of videos that I've made have been a little more outdoor inspired, relating to backpacking or hiking or trail running. And the video that I'm planning on making today is going to be a little different. It's going to be a little more nursing inspired and related to the field of nursing. A little bit about myself. I graduated high school in 2020, and I got my EMT straight out of high school so that I can start working in the hospital setting, particularly the emergency department. I was able to get a couple ER tech positions while I was living out in California. And then after a couple years, I was applying to nursing schools, and I got accepted to a nursing school here in Pennsylvania. So I moved out here. I was able to use my EMT to get myself into another ER tech position. And at this hospital, I was able to also do an internship over the past summer, a nursing internship, where I was paired directly with a registered nurse and kind of doing everything that a registered nurse does and learning the ins and outs of the field. I'm currently in my last semester of nursing school, and I am also doing another ER nurse internship, which I've been enjoying greatly. So I'm planning on breaking down kind of what I carry on my person while I am in the emergency department, fulfilling this role of a nurse intern, and what I feel is necessary to have on myself in order to carry out the job at the best of my ability, and also kind of what I carry on myself when I'm doing my clinical rotations with the school. So I hope you guys enjoy this video. We're going to shift on over, and I'm going to be breaking down everything that I carry on myself. Thanks. All right, everyone. So I'm going to be discussing with you guys kind of what I carry on my day-to-day basis while I'm working in the emergency department or when I'm on my clinical rotations. And this right here is just pretty much an all-encompassing kind of what is on my body or what is near me. So like obviously I'm not carrying a water bottle 24/7, but it's usually at the nurse's station or it's at my computer. But yeah, so we'll go into it. So I usually carry a pretty decent sized notebook here on my clinical rotations just because I typically, I'm gathering more patient information and I'm having to write down their history and physical, write down all their lab values and that sort of deal, write down my physical assessment, my findings and everything. So it's nice, I found it's nice to have a small, compact notebook that you can still write down a good amount of information on. When I'm working as an ER tech or as a nurse intern in the emergency department, I typically just carry with me some Post-it notes. These are great to have on hand so you can write down, things that that you need to remind yourself to do. So maybe you need to remind yourself to take a patient over to CAT scan in 15 minutes, or write down the lab values for certain patients, or things of that nature. It's just nice to have some Post-it notes that you can carry on you and jot down simple information to keep yourself accountable and remind yourself of certain deals. So that's that. With that, I like to bring a good pen, if not two, because I feel like pens are always the first things to get lost or stolen. So making sure you have a good pen is pretty important. And with that, Sharpies are also very important. There are certain materials that it makes it very difficult to write on with a pen, and sometimes you need a Sharpie for. So a lot of the times, if you're going to be applying topical medications or patches to your patients, you have to write down the time, date, and your initials of when it was applied. And a lot of the times, that's just not something that can be done with a pen. You need a Sharpie on there to kind of get it to adhere to the patch that you're going to be applying. So there's other uses for it, but that's probably what I use it for the most. So a good Sharpie is very important to have with you. And then next off, this is my pen light. This is a Lumen Top light. It's the IYP 365. This is the Nietzsche model. So this means that it gives off better light and allows you to visualize the wound or the skin color or whatever you're looking at in the color that it actually is. A lot of the flashlights that you might find on the market tend to drown out the natural color of the human body when you shine it on them, but with this Nisha model, it makes sure to not do that. So you can make sure that you're getting an accurate representation of what the skin's actually looking like or what the wound is looking like. A little bit about this pen. This pen light, it's waterproof, which is great. So if you drop it or if you get, a patient's bodily fluids on there, you can just go rinse it off in the sink. I feel that's very important in order to maintain cleanliness, I guess, when you're in the hospital. It's very low profile. I think it's about maybe 4.5, 5 inches. So it's easy just to slide in your pocket and you kind of forget it's there a lot of the times. And with this pen light, there's 3 different modes. So if you press the back, it has a bright mode, which is 125 lumens. Then it has a middle mode, which is about 80 lumens, I believe. And then it has a 1.5 lumen mode at its lowest setting, which I feel is great. And that's what I use it for the most. This pen light is used for a variety of things, but a lot of the times I'm doing it to assess a neurological status on a patient. I am assessing their eyes for perla, making sure their pupils are reactive to light. Other uses for this light involve looking at wounds, shining the light to get a better image of what's going on with a wound, if it's secreting any serous membranes or any secretions. And I also like to use this light to look in patients' mouths or in their nose, or if they have any wounds on their scalp or anything, just places that make it a little harder to see with a naked eye, and something that you might need to use a light for. So overall, I feel that this pen light's amazing. It works very well, and I've had it for a couple years now, and it hasn't let me down. It runs off 2 AAA batteries, which makes it super easy to replace this and get it back into action if the batteries do die. A lot of the hospitals that you work at do have AAAs, and if not, they're a very easy battery to find. Next off, I'm always carrying alcohol prep pads with me. This is very important to avoid intravenous infections or infections of the bloodstream. So whenever you are starting an IV, you want to make sure that you're cleaning the area. I use these all the time to scrub the hubs of IVs before I am attaching either saline solution or pushing medications through it. So just making sure that you're maintaining aseptic technique and keeping the situation in the area clean to avoid any chance of infections. And then with that, I always have a couple of these flushes in my pockets. You need them more than you think a lot of the times. You always want to flush IVs with normal saline before pushing medications or after, and you always want just to make sure that the IV catheter is still intact and it's patent and it's in the vein. So like I said, yeah, you're always needing to carry these, so it's better just to have them on hand. And then with that, I like to carry some of this transparent tape. It's one of those things. It's like all these small things really make the difference in the long run. It prevents you from having to go to the supply room or having to go somewhere where they stock all this stuff. It's better just to kind of carry it on you because you're going to always need it. There are a lot of the times when the transparent dressings on patients' IVs are starting to kind of fray up on the edges, and you need to tape it down to secure it better. Or if someone's bleeding, you just need to apply a gauze pad and tape it down. So there's a million uses for tape, and it's always nice to have on hand. And then with that, making sure to have a pair of gloves on you is very necessary, I feel at least. The hospital is not a cleanly place. You come in contact with a lot of bodily fluids and a lot of different germs, so it's always nice to have some gloves on hand because you're probably going to need them more than you think. All right, so now we're kind of moving into some of the more fun stuff here. This is my watch that I carry on me all the time. This is a Garmin Vivo Active 3. It's a little outdated, but it does the job. I have it in military time because you're going to be documenting everything in military time while you're in the hospital setting. And you do need a watch more than you think, either to count respirations with the seconds, or to kind of gauge how long to push a medication, because a lot of medications have different push times, or just to document your stuff, making sure that you're having up-to-date times on your vitals and making sure that everything is accurate. So using a watch is very necessary. This is what I carry with me all the time when I'm at work or at clinical. And then here, this is my stethoscope that I use. I've had this for multiple years now. This is the Littmann Lightweight 2 SE. It's a very affordable Littmann stethoscope. It's amazing. It does the job. Yeah, I mean, there's not too much to say about it. It's a good stethoscope. It's better than the disposable ones that you find a lot of the times in the hospital. You hear accurate sounds. It's great. I've had no issues with it. So that's that. And then next, I have my trauma shears here. I've had these for multiple years as well, and they have not let me down. They've been amazing. These are the X shears. So the founder of this company is both a registered nurse and a flight paramedic. He created this brand because he was kind of tired of using disposable trauma shears because they're about one and done's pretty much. Like you can use them a couple times, then you have to toss them out and get a new pair. So these are very heavy duty. They're super thick and robust. I've been able to cut through just about anything you can come in contact with in the hospital. I use these primarily for, cutting off clothing for trauma patients or to make splints, cutting the fiberglass to make your fiberglass splints for patients that have extremity damage or are needing a cast or splint made. So that is this. I know there are other shears out on the market that are very comparable. I do want to check out the Leatherman Raptor shears. I have not had them or tried them out yet, but from what I've heard, these are very similar in their ability to cut through material. I just like these because they're a little less high maintenance. They don't fold. They don't have as many nooks and crannies as the Leatherman Raptors, so they make it a lot easier to clean, especially if you have a trauma patient that is bleeding or has other bodily fluids on them. It just makes them easy to wash off. So that's that. And lastly, I think having a good water bottle for your shift is very important. Yeah, I mean, you're on your feet for 12-hour shifts in the emergency department, constantly running around. So it's very important to make sure that you're staying hydrated. I typically bring electrolyte mixes or energy mixes as well to kind of throw in here and change up just from drinking water. But I think having a good water bottle is very important to make sure that you're staying hydrated while you're doing your long-hour shift. So that's about it. That's all I got here. If you have any questions, feel free to drop them down in the comments below. Feel free to ask me any more questions about why I bring certain items, what I bring them for, if there are any other uses. But yep, I appreciate all your guys' support. Thank you for watching. Feel free to comment, like, and subscribe. Thank you.